different than the other one we did. Okay. Okay, everybody. Hello, we're live. Thank you so much for being here. Welcome to another episode of Brain Power with Dr. Echo. I have an amazing guest, and I know I say that every week, but yes, this guest is really amazing. So, without further ado, I'm going to introduce Dr. Cambri McCoy, who's a doctor of physical therapy and doing amazing work with our children with autism, helping them improve their speech. And so, can you please introduce yourself to our audience?
Absolutely. Thank you for having me. I'm so excited for this opportunity. My name is Cambri. As Dr. Echo said, I have been a physical therapist. June will make 9 years. But recently, in November of 2025, I transitioned my role and I am now a solutions consultant with a company called Tobii Dynavox. And we provide AAC solutions not only for children, but children and adults who have difficulty communicating for a gamut of reasons and diagnoses.
Wonderful. So, we're going to start at the foundation. So, for parents listening, if you ever wondered, how would my child's speech be improved with an AAC device? What is an AAC device? Like, let's just start at the bottom, right? Just so we
Yes.
can help and then build up from there, so we can help our parents know, empower them to know what's available to help their children succeed.
Absolutely. So AAC is augmentative and alternative communication. It is a way for your child to be able to communicate their needs, wants, desires, their thoughts, whatever it may be able to communicate those things with you. I forgot, what was the other part of your question, Dr. Echo?
So I said, okay, so tell us what the device is, and how can parents determine if their child will do well with having an AAC device, even if nobody
Absolutely.
has ever told you that before? So
So yeah, AAC is there's different types. There's low tech and there's high tech. But research has shown that any child with any communication deficit, whether it's their nonverbal or whether they maybe have apraxia, research has shown that about 89% of people who use AAC, their speech improves. 11% of people, their speech stays the same. But no persons, no child, no adult gets worse due to the use of AAC. So it's absolutely worth the risk in trying it. And honestly, there may be a financial risk depending on insurance, but other than that, there is no risk to trying AAC with your child, whether that's having little, even like the alphabet, the magnet alphabet on your refrigerator and having words on there and they can point to different words, or having pictures and symbols around the house so they can point to that want water. That is a form of low tech AAC. And then it just gets more high tech when you have a device in order to communicate even more thoughts on a higher level.
okay, wonderful. So can you walk us through how the devices, you mentioned apraxia. Can you tell our listeners, what do you mean by apraxia, and how does that apply for
Yeah,
the use of
apraxia of
AAC?
speech is when the brain has difficulty connecting with the motor processing. So the brain knows what it wants to say, but the mouth has trouble coordinating the muscles in order to get those words out. And so kids with apraxia, when you're using AAC, especially high tech AAC, and you're using words and you're clicking bubbles is a big one, or you're clicking on water, they're hearing that word more, and just by that auditory feedback, you're getting more input into that sensory input into that child, and it helps them to be able to practice more in using those words that they use so often.
Okay, wonderful. So you also mentioned insurance. Does that mean that AAC devices, that's the only way you can get it, is through insurance, or how does that work?
No, insurance is a big factor. You can, like most things, you can pay outright for these devices if you want to. At Tobii Dynavox, we call it direct bill. And so you can pay outright for the devices, but many insurance companies will cover the cost of the devices, which we usually go that route first to see if your insurance covers it. If they do, how much do they cover? If they only cover partial, then we look for grants and things of that nature to see if we can help you pay for the remaining. Sometimes it's like a remaining 20% of the device. So insurance is definitely a big factor, but a lot of them do cover speech generating devices.
Okay, wonderful. So, in your experience working with kids and assisting them with getting the devices, what have you what have you found? This question I'm about to ask, I'm sure it's child dependent. I was gonna say, but every child is different. But I'm gonna ask anyway. So, like, how soon do you start to see a turnaround with improvement in the ability to communicate?
Man, Dr. Echo, even yesterday, I had the most precious little girl, and people think, "Oh, I don't want to start too soon," or you don't want to start whenever. This little girl was probably like 1.5. I know she wasn't quite 2 yet, and I know she was over 1, so we're gonna call her 1.5. And she was able to select bubbles, and you knew she was intentionally selecting bubbles because then as soon as she hits it, she's looking up, and then she smiles when she gets her bubbles. I've had one child who he was diagnosed with level 3 autism. Excuse me, the daughter, his sister, was diagnosed with level 2 autism. So she has a few words in there, but she went and we went through one of our motor plan page sets, and she connected the dots within like 5 minutes. So these kids catch it. I am shocked because in my therapy career, I've never worked with kids. And so working with kids now, I get so shocked at how quickly they pick up these things. It does not take long at all. And then there's ways to grow their language so that they're not overwhelmed in the beginning, but you can grow their language a little bit at a time. And it varies. To answer your question, it varies. But it is just so amazing to see what they are able to do in a short amount of time, usually.
Yes, yes. So for those parents who are listening and maybe you're hesitant to try, and is there do parents fear that their children will get dependent on the device? Is that a thing?
Yeah, that is a big myth that, oh, if they use this device, they'll never talk.
Mhm.
That is just a myth. AAC only improves that sensory input, so they're having access to more words and they have more words available to them, but it gets them practicing. And even my little girl yesterday, she was pressing bubbles, but she was also saying bah, and she was getting that. And every now and then she say bah, bah, like bubbles. And so every now and then she get it out. But because verbal communication is still faster than AAC, kids want that immediate feedback. So if we're using AAC, they're still going to be inclined to want to verbally communicate as well.
Okay, so for the parent watching who doesn't who their first language isn't English, are AACs available in different languages? Is it?
Yes, and we have a lot of different languages at Tobii Dynavox. So we just came out with a lot of new languages for specific page sets and different things. But we have English, Spanish, Mandarin, Portuguese, French, German, Dutch. If I said that right.
Yeah.
There are so many different languages, and we even have, because Spanish is so common in my area, I'm in Oklahoma, we do have page sets that are already set to be bilingual, so that you can switch in the middle of a sentence. You can switch between English and Spanish.
Oh,
So
nice.
there are lots of different languages available within our software.
Okay, wonderful. So I love that that's wonderful, right? Because we want kids. I tell parents, kids can learn as many languages. Like hit them up with 10. Like how many do you want them to learn? Because their brains are simply like sponges. I'm still trying to do my Spanglish, so I'm talking to myself. I need to do better. But yes, if you have kids, younger kids, let them learn as many languages as possible. And so yeah, that's
It helps
wonderful.
you
That
learn too, because now your
yeah,
kids are speaking to you in another language. So
yes, yes, absolutely. And that's so cool that they can hear words in different languages and it only helps with their brain
yeah,
processing.
yeah.
So what other myths do parents have with regards to devices that we you think it's important for us to address?
Yeah, so another one we talk a little bit about it is financing. Oh, I can't afford it. Another one is I can't start too soon because they're so little, or I don't want them to get. A big one is I don't want them to get attached to this device, and they're looking at technology. But we really have to keep in mind that yes, it's technology, but this is not scrolling on Instagram. This is their voice. And for people who are verbal communicators, we have our voice 24/7. And so
Right.
we want to make sure that their device is their voice and they have it with them. They have access to their voice 24/7. So, what some parents and families will do, and it works for some and not for others, but for some, they will have their voice, their speech device, and then they'll have a separate iPad or tablet for games and scrolling the internet or what have you. But that's another big myth is that, oh, I don't want them sitting in front of a screen every day. But it's just important to remember that it's their voice
It's their
and
voice. It's
they
their
should have
voice.
access to it.
Yeah, wonderful. So, thank you so much for sharing all of this. So, for parents listening, if your child is nonverbal or your child has been diagnosed with apraxia, this is something that definitely can help your child improve their communication. You heard her say it's their voice as their own human voice comes through. They are learning in the meantime, and they can communicate their needs, which of course will definitely decrease frustration on their part and on your part, because now both of you can communicate, the bond is stronger, right? And healing takes place faster. So tell parents where they can find out more about your AAC devices.
Before I answer that, I do want to say we have tons of voices, and we just came out with a bunch of new voices too. So if you have a son or a daughter, or they're a teenager, or maybe they're 2 or 3, we have voices for different age ranges, for different genders as well. So you can really customize that to
Oh,
you
nice.
and your
That's
child's needs.
cool.
So yeah, that's pretty awesome as well.
Okay.
To get a device, if we're going through insurance, it does have to be. Um, it does have to be recommended by a speech therapist. So get with your local speech therapist. That speech therapist can write up an evaluation. Again, our company is called Tobii Dynavox, and you can find lots and tons of resources on TobiiDynavox.com. On the Contact Us tab, there's also an area where you can find your local solutions consultant, where you can put in your zip code and find the email and phone number connected to that consultant, and get in touch with them and say, hey, this is what's going on with my child. They see this speech therapist, and you can have a speech therapist reach out to us. We will come out to that appointment, meet with you and the speech therapist. We can bring our devices to that appointment. And during that appointment, we just try different things out. Any success looks like them looking at the device. Success looks like them touching any button, even if they perseverate on a button. A lot of families are like, he keeps touching this button. It's okay. It's okay. Let them perseverate and try to redirect things like that. But success comes in many forms, and it's not 100%. It's not perfect. Even our neurotypical children, they don't get it right 100% as they're learning the new language. So we just have to be cognizant that it's a learning process, and success looks different from child to child. But there's lots of different resources. Get an account at mytobiidynavox.com and explore all of our courses in our learning hub. We're going to revamp in a few weeks, a few days, I think next week. We're going to revamp of our learning hub, so it'll be really nice, user friendly to have access to that. So, yeah.
Wonderful. I love it. I love you. Ooh, ooh. That's funny. Okay, great. And it's just one thing I wanted to say based on what you said. Success looks different. And please celebrate every win you
Yes.
see, everything that's going in the right direction. Celebrate, because that is so critical. Your children will be more encouraged to continue in the path, the progress that they are making. And so, and it helps your heart too as a parent, right? When you recognize, when you stop stop and smell the roses and see the progress versus, oh my goodness, nothing is changing. Like what was different today than it was yesterday, right? And that's what we want to focus on. So thank you so much for sharing about where to contact you. And parents, this is not out of your reach. It's absolutely possible. All things are possible. You heard her say if you don't have insurance, they won't cover the full thing. There's grants, there's other ways that they will work with you to help you figure out how to get the device. So please don't hesitate. So wonderful. Thank you so much again for coming on here.
Oh,
And
thank you for
what
having me. It's been fun.
my pleasure. What's one last tip you want to leave for parents before we go?
Oh, one last tip: breathe, breathe. That's my favorite tip for anybody. It's a lot going on. It's a lot to process, especially a new diagnosis. Breathe, learn, be willing to adapt, and as most parents do, continue to do what's best for your kiddo.
Yes, absolutely. And remember, you're the best parent for your child. Your children are valuable. They just want to be seen, heard. So please take the time to focus on yourselves so you can pour into yourselves and also your children, right? Because we can't pour from empty cups as parents. And do I know that? Yes, I do.
Well,
Okay, that's a whole other conversation. But yes, please do that. Please do that. Take care of yourselves. And if for any reason you need an evaluation or you know someone who's waiting on a long list, reach out to us at Glow Pediatrics. If you would like holistic care to address root causes of what's going on with your children, constipation, their focus, their sleep, reach out to us at Glow Pediatrics. And thank you again, Dr. Cambri, for coming on here. Such a pleasure to talk with you.
thank you so much.
My pleasure.